What's the difference between dizziness and vertigo? And when is it, this will go away on its own versus, wow, this is serious and I need to get some help? I'm Dr. Angela. Today we're going to talk about the difference between dizziness and vertigo and when it's a get help now situation. So dizziness is feeling lightheaded, weak, unstable, tippy. The feeling is inside you and you just feel like you might faint, you might tip, you might fall down. Dizziness can be caused from dehydration, it can be a medication issue, and lack of food, little low blood sugar. Any of those things can cause dizziness. If you are feeling dizzy, one of the best things to do is to slow yourself down, especially those transitions from sitting to standing, from lying down to standing up. Don't sprint out of bed, sprint out of your chair, come to the edge of your chair, sit up from lying down, hang out for a minute, and then get up, okay? Maybe position things near you so that you can touch a wall, make sure you're not dizzy when you're walking, but just slow things down a little bit. And stay hydrated, especially in the summer, all right? It's really easy to get dehydrated, especially on super hot days. In contrast to dizziness, there's vertigo. Dizziness is inside you. Vertigo feels like what's outside of you is moving. Whoa, the room is spinning. Whoa, kind of like you've just been on the tilt-a-whirl and then you stand on the ground and you're like, I'm still moving, the world is moving. So typically with vertigo, things will move rightward away from you or leftward away from you. Some people might think of that as clockwise or counterclockwise, but it feels like the room is spinning. You can close your eyes and think, I know I'm sitting here, I'm still, and you open your eyes and you're like, whoa, the world is spinning. That is vertigo. If you are struggling with vertigo, go get some help. I'm trained in vertigo treatment. Physical therapists are always trained in vertigo treatment. Go get some help if you're really struggling. Go get some help as in let somebody else drive you there, because you should not be driving when you have vertigo, because that movement around you is very disorienting and we all want to be safe on the roads. There are plenty of DIY vertigo treatments. If you look up YouTube, you'll find them. If you're having a really bad vertigo episode, go somewhere, be treated, have them do it with you, and then you can learn how to do it on your own so that if it ever reoccurs, you know how to do it. But if it's your first episode and you're completely nauseated, or you haven't been able to keep food in because you're so nauseated, if you've been throwing up a lot, get some help from someone else first and do the DIY stuff on your own once you know how to do it. With either dizziness or vertigo, if you fall, if you have any additional symptoms like severe headaches, the nausea, the vomiting, the diarrhea, any inability to talk, racing heart rate, shortness of breath, anything that's serious and worrisome, please don't wait for it to go away. If you have a little bit of dizziness and you're like, if I slow down, I'm fine, fine. If it's something that's worse than that, please don't think it's going to go away on its own. Just go get checked, rule out anything terrible, and just make sure you're getting the correct treatment. If you have any questions, please let me know.